I wish I could say that it was an honor and a privilege to be standing before you today or to be sitting here before you today, but it's not. Too often in this building, we've had silent conversations about gun violence, and nothing has changed. So today, we're going to start working toward those changes. We're going to bring the voices of the victims, families, advocates, police officers, and legislatures together to have a very real discussion about gun violence. We're going to talk about the human aspects of gun violence and the cost. Too many times have I had to enter a church, think of what to say to a grieving mother who's lost her child to gun violence. Too many times I've seen caskets close and the wails from those families knowing that they will never, ever get an opportunity to see their child again. But compared to what those families have to go through, this is the easiest part of the job and the very least that I could do. Because this crisis doesn't just stop at city limits. Gun violence is tearing through through communities all across the state. So that's why we're here today. We're not here to recite statistics, even if we know those by heart. We're here to hear from people living this reality. We're here to hear from survivors, police officers, from doctors, from advocates, from people doing the work every single day to combat this crisis. The people who are standing on the front lines and making sure that there aren't any additional victims. And I know we're tired of hearing the same call to action from me and so many other legislators in this building, but the stories you'll hear today about real people, real lives, cut through the noise in a way that numbers never could. So thank you. Thank you for being here. Thank you for showing up. Thank you to the speakers who are about to share more than just their testimony, but their lives' work. Thank you to those survivors and to the family members who have lost loved ones because we didn't act fast enough. And thank you for helping to make it clear that the human cost of gun violence is a price that we're no longer willing to pay. Now I'm honored to introduce my colleague, Representative Joan Fitzgerald. She's been a tireless advocate in the gun violence prevention movement and will be leading off our speakers and introductions today. So thank you.
Thank you, Senator Johnson. I'm proud to be here today in the effort to reduce gun violence in Wisconsin. As someone who's worked with Moms Demand Action and other community groups, I know how important it is to elevate the voices of those directly impacted by this crisis. It's now my honor to introduce someone whose story represents just that. Tiffany McAfee is the founder of A Mother's Cry. She lost her son in 2019 to gun violence. Since then, she's turned grief into action by creating a support network for other mothers across Milwaukee. Please welcome Ms. Tiffany McAfee.
Thank you so much for allowing me to be here to speak. I never thought gun violence would directly impact my life, and I never thought I would lose a son to gun violence. Today, I'm a single mother of 10 beautiful children, 6 boys, 4 girls. When I had my first son, I knew I had to focus on being the best mother ever. I learned to raise my kids on very little, and I learned how to survive. I did the best I could with what I had. And no matter what, we always stayed together. My son, Montez McAfee, was killed in an ambush on June 29, 2019, in Milwaukee, Wisconsin. There were shots in the double digits, but only 2 hit him, one in the head and one in the back of his arm. The first bullet killed him within 5 seconds. Not to mention, he died on his father's birthday and his little brother's birthday. The pain I have to live with daily is a pain no mother should bear. I'm also a domestic violence survivor, which at the time I had just moved to Atlanta after being so abused by my ex-husband. So my life was really lifing at the time. It took me 3 whole years to get justice. And when I left that last court date, I still didn't feel any different. I knew I had to do something because the gun violence is out of hand in Milwaukee. So I turned my pain into a purpose. And I started a nonprofit organization called A Mother's Cry. A Mother's Cry is a support system for mothers who not only lost a kid to gun violence, but lost a kid, period. And this year will be my second annual event where I honor from 15 to 22 women with a dinner, gifts, plaques, and lots of fun for the day. The event takes place on my Tez's death date, which is June 29th, and I'm so honored to be able to honor these women in their time of need. I love doing what I do for the mothers. I believe it's my calling. I want to make more awareness of the gun violence, not only in Milwaukee, but other cities too. In closing, I would like to say that it is okay not to be okay. Losing a child placed me in a dark space, and I had to learn to live without my son. I would say from experience, have a support system for difficult days and be open to cry when you need to cry and yell when you need to yell. It's okay. Just take your time. Everything will heal. Thank you so much for your time.
Thank you for being here. Thank you for
so
your
much.
courage and your leadership in this area.
Thank you.
Greatly
so much.
appreciated. Our next speakers know this issue from another angle. They are the first responders tasked with addressing it on the ground. Please welcome Captain Raymond Bratchett from District 3 of the Milwaukee Police Department and Lieutenant Eileen Ross from the Milwaukee Police Department's Gun Violence Division, who will speak about their direct experiences responding to gun violence in our communities.
Good morning. First of all, I want to give you my sincerest, deepest condolences for the loss you suffered. No one should have to endure that pain, that suffering as a result of gun violence anywhere. So you have my heartfelt condolences. Good morning. Thank you all for giving us the opportunity to come before you and speak today. I come to you not only as a captain with the Milwaukee Police Department, but someone who's walked with officers through countless scenes of pain and tragedy. Living rooms torn apart, sidewalks stained with grief, young lives taken or forever changed by gunfire. I've seen the ripple effects of gun violence not just as numbers on a report, but as mothers weeping on porches, children traumatized before they understand the world, and officers struggling to carry what they witnessed shift after shift after shift. Now, Milwaukee is not unique in facing this crisis, but we are deeply impacted by it. We respond to a large number of shots fired calls on a daily basis, and our hope is that it's just a property damage. But far too often, it's another young person, another family, another irreversible loss. And we're seeing an increase in gun violence involving juveniles, both as perpetrators and as victims. Innocent bystanders, people who have no connection to these conflicts, sitting on their porches, riding in their vehicles, sleeping in their beds, are becoming victims. Their families in our city are being deeply impacted by this violence. From 2020 through 2022, Milwaukee faced unprecedented levels of shootings and homicides. Many involved people who knew each other, arguments, retaliations, domestic violence incidents that escalated to deadly levels. And while we're seeing an encouraging progress in some areas, such as a reduction in non-fatal shootings in 2024, the need for sustained and focused action remains urgent. We are seeing more guns on the street, more guns in cars, more guns being stolen from cars, more guns in the hands of teenagers. And we're recovering firearms with machine gun conversion devices, which is commonly known as switches, that convert pistols into illegal automatic weapons, something we almost never saw a decade ago. But we're not standing still. Milwaukee's approach to violent crime is rooted in a strategic framework that combines enforcement, prevention, and partnership. We know that simply responding to crime isn't enough. We have to be proactive, data-driven, and community-centered. One of our most critical tools is our public safety review process, in which we bring law enforcement, analysts, prosecutors, outreach workers, and public health partners to look at the full picture after a shooting occurs. From there, we develop a real-time response, whether that's enforcement, mediation, or engagement through our community partners. This feeds into our focused deterrence strategy, where we identify the small number of individuals driving the majority of serious violence, and we offer them a choice. Face serious legal consequences if the violence continues, or accept support and services to change course. This isn't about mass arrests, it's about precision. It's about giving people a reason and a path to choose something better. We also focus on place-based strategies, using data to identify high violence blocks and corridors, and then working in tandem with city departments, outreach teams, and residents to address the underlying conditions, whether that be blight, poor lighting, abandoned properties, a lack of recreational opportunities. Because the environment sends a message, and we want that message to be, you are seen, you matter, this is your neighborhood. Milwaukee's Office of Community Wellness and Safety, violence interrupters, and credible messengers are key partners in this work. They go where we cannot. And they speak with a voice that reaches people before the triggers are pulled. We've responded to scenes together. We've hosted pop-up resource events in the aftermath of violence. And we've saved lives by reaching someone who's on the edge. Our youth engagement strategies are equally important. The Milwaukee Police Department supports school resource officers, after-school initiatives, and summer programs that connect young people to mentors and opportunities, because early intervention is the best type of prevention. Internally, our department holds itself accountable. We use data-driven deployment, meaning we track where violence is happening, analyze the when and the why, and shift our resources accordingly. We also review our progress constantly, not just arrests, but outcomes. Are we reducing harm? Are we preventing shootings? And are we building trust? But data alone doesn't capture the full weight of what this violence means. Behind every statistic is a person and a family. Excuse me. And a future cut short. And that's why our commitment to accountability isn't just about performance, it's about people. To the families impacted by gun violence, please know we carry your stories with us. Your loss strengthens our resolve. We know that behind every crime scene is a human story. And it's our duty to honor that story, not just with arrest stats, but with meaningful change. Your pain is not forgotten. It drives us. It reminds us why we do this work, and it pushes us to do better. Gun violence is not normal, and it never should be. Thank you. Now I will turn, I'm going to turn the mic over to my partner, Lieutenant Eileen Donovan Ross.
Good morning, everybody. And I'd like to thank you as well for inviting me and allowing me to speak today. Prior to being a part of the Gun Violence Division, I actually spent 15 years of my career in patrol, on the patrol side. And doing that, 9 of those years, I was part of the Community Prosecution Unit as an officer and as a supervisor. While doing that, I was able to engage in all sorts of aspects and dealing with the community and really seeing the impact that all the different crimes have within our neighborhoods. Some of our greatest stories that we've had and conversations that we were able to have within the community are at just normal block watch meetings, where we can really get an understanding as to what people are experiencing within the neighborhoods that we are representing and out there trying to help those. And that's why a lot of the times our officers are doing what we're doing, trying to see that aspect of everything and the human side and how we can help. Now, while the district deals with the department's violent crime plan on a more proactive and preventative measure, as being a part of the Gun Violence Division, we are dealing with this as the investigative standpoint, seeing what more can we do within our investigations and how we can assist in some of the proactive and crime prevention aspect of everything. So the Gun Violence Division investigates the non-fatal shootings of the city of Milwaukee. Our role is to supplement and enhance the initial response that the Patrol Bureau has. Our Gun Violence Division conducts our investigations citywide, and we have the ability that that way, since it's all the different investigations, we can link the violent crime activity across all districts. From an investigative standpoint, we utilize technology to aid in their investigations, such as the NIBIN system, which is the National Integrated Ballistic Information Network, which is used to connect casings and firearms of these crimes. In addition to that, we are able to use ShotSpotter technology to assist us when people are calling in shots fired. The ShotSpotters also tells us directly where the gunshots are coming from. And that helps our officers and then down the road detectives to go out and see where we can talk to, who we can talk to, and helps us in our crime solving ability. Now, our CIB functions that we have the different divisions. We have the gun violence division, and we also have our homicide division. And we're the ones that are dealing with all the non-fatal shootings, firearm-related offenses. Based on what we find in our investigations, it can vary. Many incidents stems from fights, and what we're seeing that many of these incidents are stemming from fights and arguments that then escalate into gun violence. The motive as to what we're seeing varies with that. We have the arguments that stem from family-related issues that lead then to other domestic issues that they have. Also, some of the things that we're seeing firearm-related incidents and shootings amongst fights between our juvenile offenders and the resurgence of our juvenile offender groups. We are seeing robberies that escalate and turn into shootings and family and domestic incidents. When we're dealing with this, we work with all of our different community and intergovernmental partners and provide context of the incidents in our investigations to help them determine the resources that can be used and provide to our victims, such as these groups are the Office of Crime, Violence, Community Wellness and Safety, and our VRFAST group, which is the Violence Response Public Health and Safety Team. Weekly, we conduct our PSR meetings, which is our public safety review. We provide the context of all these investigations and where we're at, so then we can work with our community groups in order to try to reduce the number of violent crimes that are going on in our city. We have been seeing repeat offenders and work with victims and victim advocates from the district attorney's office. We realize that our detectives' involvement in trying to deal with and working with the victims will help us lead to successful prosecution down the road. And our department realizes and sees how important it is to have these victim advocates, in which we will be having the Milwaukee Police Department, a victim advocate that will be working directly with the Gun Violence Division, so we can have our detectives have an engagement with our victim throughout the whole process. We know and realize that some of these investigations do take a long time, and it is a toll on our victims. It is a toll on not just them, but their families and those that are directly involved with that. And keeping that engagement that we have throughout the investigation will help then with the successful prosecution of these matters. Thank you.
Thank you, Captain Bratchett, Lieutenant Ross. We certainly appreciate your service. Thank you for that. We know the work is exhausting, but we appreciate you being here. That's for sure. So thank you. Next, we'll hear from someone who sees gun violence not just as a public safety crisis, but as a public health emergency. Dr. William Kalowitz is a family physician on Milwaukee's North Side. He works in both clinical and hospital settings and holds a dual certification in preventive medicine. His research focuses on population health and what it really means to care for survivors beyond the ER. Dr. Kalowitz, thank you for being here.
Thank you for having me. As was mentioned, my name is Bill Kalowitz, and I'm here today as a physician, but I'm also here today as a father and as a constituent. As a scientist, it's my job to tell you the stats and statistics behind gun violence, but first I want to start with a patient story. I was a first-year resident on my first day of the ICU rotation, and I was assigned to the care of Mr. S., a 23-year-old man who at that point had been in the hospital for 3 months. He suffered multiple gunshot wounds while he was standing at a gas station pumping up his car as an innocent bystander. As I entered the room not knowing what to expect, this man was connected to all the machines you could think of. He had a breathing tube coming out of his neck, IVs sprouting from all of his limbs, machines beeping everywhere, and tubes for disposing of his feces and urine. As I frantically searched to find where the chronic wound site the nurse had asked me to examine, I felt a tap on my shoulder directing me to that site. As I looked up, I met Mr. S's gaze. What I saw was a man not much younger than myself at the time, whose life was forever changed by an act of senseless violence. I still see those eyes every time I fill my car up with gas. I share this individual story, but this story is not unique. These stories are all too common in the US. I've also seen what Mr. S's future looks like. I've seen his future of chronic disability, chronic pain, chronic wounds, PTSD, and depression. I've also seen what the shrapnel of gun violence does to the families and friends of people who experience that. I've taken care of parents, siblings, and friends following up due to PTSD, depression, caregiver burnout related to this. Sorry about that. I'll be clear that gun violence is a public health emergency. Each day, 120 Americans die from gun violence. Guns are the #1 modality used in suicides, homicides, and domestic violence. Guns, as of 2022, are the #1 cause of death in children aged 1 to 17. That accounts for over 1 million years of life lost in the US annually. That's more than diabetes, stroke, and liver disease combined. But we're not here just to complain about gun violence today. We know that there are solutions that work to prevent gun violence. Firearm licensing, protection orders, community violence interventions, and safe gun storage are all proven evidence-based interventions that can decrease rates of gun violence. I don't know about you, but if I knew that the #1 cause of killers in children in the US was preventable, I'd certainly be looking for solutions to fix that. However, my job is not to make laws that protect the citizens of Wisconsin. That's the job of our representatives. My job is to share with you the facts and realities of gun violence in our communities from a health standpoint. As a father, physician, and constituent, I implore you all to consider what you can do to help reach out to your representatives to make our communities safer. Thank you.
Thank you, Dr. Kalowitz, for everything you do, not only to treat the wounds we see, but the ones we don't see. Thank you for being here. Now for a look at where the policy stands and what Wisconsin could do if we had the political will. We turn to Nick Matuszewski with WAVE. Nick is an attorney and advocate for gun violence prevention. He serves as Associate Executive Director of WAVE Educational Fund, Wisconsin's oldest and largest gun violence prevention organization, and leads the Wisconsin Gun Violence Prevention Coalition. A William and Mary Law School graduate, Nick is committed to creating a safer, equitable future for all. He's a respected voice in the prevention space and will walk us through the kinds of reforms that are working in other states and could work here too. Nick, leave it to you.
Thank you so much. Thank you all for being here. As the rep said, my name is Nick Matuszewski. I lead the Gun Violence Prevention Coalition here in Wisconsin, which is made up of several different organizations that work at the state level, including some national groups like Brady, Everytown, Giffords, a lot of groups that maybe some of you have worked with or know about. For the longest time, our groups were working towards the same solution, but from different angles. And what we learned was that the gun lobby and those who benefit off of gun sales and gun tragedies were noticing that we were not working in unison. We've kind of addressed that by coming together as a coalition and deciding that we would speak with one voice and decide collectively which policies we wanted to push for, prioritize, and get passed here in Wisconsin. I'll take some time over the next 10 minutes or so to walk through our top policy priorities, kind of spelling them out what they would do, and why they're so important. I know I've spoken with a lot of you here already, so a lot of this might be repetitive, but these are very foundational policies that we've pushed for time and time again, and we're just not seeing progress yet. So we really are urging everyone here and throughout the entire building to take these policies seriously and push for them. So the first policy I'll talk about, that many of you have probably heard of, it's perhaps the most foundational policy around concerning gun violence prevention, is universal background checks. These policies are set up to ensure that every gun sale in the state of Wisconsin would have to go through a background check. Right now, in the state, if you wanted to buy a firearm from somebody using an online method, perhaps a website called Arms List, or if you wanted to go to a gun show where individuals get together and sell guns out the back of their truck, or any number of different methods to obtain a firearm, you can do that without going through a background check. And this has been shown to be very attractive to people who know they wouldn't be able to pass a background check. If you know you're not going to pass a background check, of course you're going to find a different way to try to purchase your firearm. We know from research that around 22% of gun sales in the US have happened without background checks. We think it's actually higher than that because you just can't really tell exactly how many sales are happening. And certainly here in Wisconsin, because we don't have universal background checks, that percentage is probably much higher. So what we find is that when individuals are able to buy firearms from just about anywhere, the rates of crime with those firearms go up, and the level of incidents of violence and other things that we're trying to prevent skyrocket. So the solution is to have universal background checks so that every gun sale in the state has to go through a background check. And the way that would be done is that individuals would take their firearms that they're selling. If there's a sale happening, they would go to a federally licensed firearm dealer and have a background check run there. Some people will say that's too time consuming, too much work. The really fascinating thing is that there are far more gun shops in Wisconsin than there are McDonald's. For 99% of people in Wisconsin, they're within 10 miles of a gun shop. So it's really not asking that much to say, okay, if you're gonna do a sale, go into a gun shop, have a background check run, and then we can ensure that people who are getting their guns are legally able to own them. So that's really probably the most foundational policy that we're pushing for. Every other restraint we have on gun access wouldn't be as effective if we can't ensure that all sales actually go through a background check. So universal background checks, one of the first policies that we're really strongly pushing for. And I can say from looking at other states that this has reduced rates of gun violence and gun crimes. I'm happy to go into more detail with all this if you have questions afterwards, but I do want to get into a few other policies really quickly. Another incredibly important and foundational policy is an extreme risk protection order, also known as an extreme risk law, also known as a red flag law. These are policies that allow for family members, law enforcement, and in some states it's drawn up that healthcare providers and others as well are able to go to a civil court, not a criminal court, but a civil court, and ask a judge to initiate a process to remove a firearm from somebody who is deemed to be an imminent threat to themselves or others. We see this policy get mentioned a lot when talking about mass shooting preventions, or preventing mass shootings rather. And it is useful in that situation because we know that there are instances where people say, gosh, there are so many signs. They were posting on social media things that were very concerning. Family and friends had concerns and doubts. And we even know that with the mass shooting that happened here in Madison at a school, Bun and Life Christian School, that police were unable to remove the firearm from that individual, but that she was having conversations with somebody in California, and they were able to remove his firearm with an extreme risk law prior to an incident. And she was also communicating with somebody in Florida, and they were able to remove his firearm before an incident because they also have an extreme risk law. But we don't have that here. So if somebody is acting erratically or doing things that are of concern to their loved ones, if they go to remove their firearm, and that person doesn't want that firearm removed, they can report that as theft, that you stole my property. We need a legal way that offers individuals a chance to act and remove firearms from situations when they think somebody is a threat to themselves or others. And a threat to themselves is actually the most important part here, because although this policy is useful in preventing homicides, mass shootings, crimes, it's actually really designed and more useful at preventing suicides. Firearms are the most lethal method of suicide, and it's often the case that individuals know that somebody in their family is having suicidal thoughts and tendencies, but they're unable to remove that most lethal method. So this is what an extreme risk law would do. 21 states and DC have already enacted these laws, and we've seen over the years that their rates of suicide by firearm have dropped precipitously. So another very important policy that we are sadly lacking here in Wisconsin. Got just a few more. Something that's very unique with Wisconsin is that we have a domestic violence misdemeanor loophole. This one, not to get too technical, but federal law says that if you are found guilty of a domestic violence act, whether it's a misdemeanor or a felony, you have lost your right to own a firearm. Your firearms will be removed, and you will not be able to purchase a firearm going forward. In Wisconsin, we do have a felony domestic violence charge, but we do not have a misdemeanor domestic violence charge. So for decades, people who committed an act of domestic violence that didn't reach the level of a felony, or they pled down from a felony, were being charged with something maybe like assault and battery or disorderly conduct, something like that. And our courts held that because the act was such that it was a domestic violence act, they had their firearms removed. Unfortunately, in 2022, the Supreme Court here in Wisconsin ruled unanimously that those charges, because they are not domestic violence charges, were not able to trigger the federal prohibition. So everyone who had their firearms removed under that previous legal regime or ruling was able to get their firearms back. And then since then, people who've committed acts of domestic violence have been able to keep their firearms. And as you wouldn't be surprised to hear, the rates of domestic violence homicides have surged since then. And the percentage of those homicides that have been carried out through a firearm has also gone up. 78% of domestic violence deaths in Wisconsin are carried out with a firearm. So we want to close this loophole. We want to create a domestic violence misdemeanor charge so that these folks aren't slipping through the cracks and they're covered by the federal prohibition. So that's the third policy that our coalition is working very hard on. Another one is investing in community violence intervention. It's a policy that a lot of folks here have already mentioned, but just to go into it a little bit more, community violence intervention is finding those who are most likely to be caught up in violence, either as victims or perpetrators of violence, and oftentimes they're the same people because it's a cyclical situation. Working with these individuals by giving them, job training, educational opportunities, access to welfare, using what's called violence interrupters, who are trusted community members, leaders in the community, to go into these scenarios and talk to individuals, mediate conflicts, provide trauma care, any number of things that we find to be incredibly effective preventative measures that ensure that there's not retaliatory violence. So for instance, if you are shot or harmed in some way and you're in the hospital, you might have a violence interrupter go there and do something that's called hospital-based violence intervention, which is working with the victims of gunfire and their family to ensure that there's no retaliatory action. We've found that cities that fund community violence intervention programs have lower rates of gun violence than those that don't. And in some cases, the rates of gun violence drop by 60% or higher. This has been shown around the country. Unfortunately, funding for these programs has been kind of a constant battle And the Trump administration has cut funding that had already been provided to programs around the country through DOJ grants and HHS grants. And now a lot of programs, including here in Wisconsin, are at the risk of losing funding by the end of 2026. So it's really incredibly important to fund these programs. We've been pushing, the governor's been pushing to get some of the funding in the state budget. So that's an ongoing battle, if you will. The last policy I'll talk about really quickly is strengthening Wisconsin's child access prevention law. So child access prevention law is any law that basically deals with if you have a child in your home and you have a firearm, how you have to store that firearm properly. Currently, the law defines a child as anyone 13 and under, which clearly is not the typical definition of a child. And it also only comes into effect if a firearm is used by a child to cause harm to somebody else or that child's self. We want to change that law so that it applies when it's 18 and younger, a more typical definition of child. And we want to ensure that even if a child doesn't get access to that firearm, if the firearm is left unsecured and they could get access, that should be a penalty. We know that parents are very unlikely to ever assume that their child would use a firearm to harm themselves or others. So they don't really worry if the only time the punishment comes into effect is if the firearm is used to harm somebody. But the truth is, any child is capable of doing these terrible things. So we know that in the Abundant Life Christian shooting, the individual was a 15-year-old who got access to her father's firearm. And because our law only applies to 13 and under, it didn't apply here. So we want to raise the age to 18 and also change when it comes into effect. So those are the top 5 priorities for the coalition. There are other things we're working on. There are so many policies that would reduce gun violence. These are 5 of the most foundational ones. But we're also looking at, a 48-hour waiting period, working to ban ghost guns, and so much more. So if you have any questions afterwards, I'm happy to stick around and answer some things. But those are kind of the primary policies that we should be fighting for. Thank you.
Thank you, Nick, the Associate Executive Director of WAVE. I certainly want to thank you, Senator LaTanya Johnson, for organizing such an important symposium. Thank you, Representative Joan Fitzgerald, for moderating this panel. I want to thank every one of the speakers here today. The founder, Ms. Tiffany McPhee of A Mother's Cry. Thank you for sharing your story. I know it wasn't easy, but it's necessary. Yes, ma'am. Ma'am, thank you so much for sharing. To Captain Raymond Retchard of the Milwaukee Police Department, District 3, and Lieutenant Ross for the Gun Violence Division, Dr. William Cowart, thank you so much for your comments here on today. It certainly made a difference. We appreciate your willingness to come before our colleagues in the legislature and to share your stories about the devastating impacts that gun violence have on our families and on our communities. Today, we heard of the pain of a grieving mother. We heard about the weight that law enforcement carries when responding to these critical incidents. We have heard of the toll that the constant, unmitigated gun violence had on our healthcare system and our providers. If we in this Capitol had the courage to act now, we could adopt solutions to this crisis right now. So my question is, what are we waiting on? How many more victims before we do something in this building. We could enact universal background check on gun sales, 48-hour waiting period on the purchase of handguns, both bills that I have introduced for years in this building, but have yet to receive just a public hearing. We need extreme risk protection orders in the state of Wisconsin. We could promote safe storage and responsible gun ownership so that no family has to lose a child because of an unsecured firearm. We could fund the Office of Violence Prevention, which Governor Evers created an executive order based on a bill that I introduced in 2021. Gun violence is not inevitable. It is a policy choice. And Wisconsin has made the wrong choice for far too long. In my own district, I have seen the horrific cost of gun violence. You've heard over and over again about December last year, the tragic mass shooting that took place at Abundant Life Christian School, which is in my district, where 2 members of this community were killed and multiple students were injured. Those who were injured continue to recover, and too many of my constituents' lives will never be the same. As a legislator, as a mother, I will never forget that day. I held a listening session at the end of January following the incident because I wanted to know what was happening with my constituents. I wanted to talk about the trauma that was impactful in my district. I wanted to talk about the gun violence incidents that occurred in my district. And just at that listening session, and thank you, Senator Johnson, for attending, we had over 150 attendees because people wanted to share what was happening. The gun violence in my district has not stopped since this horrific shooting at Abundant Life Christian School. Just this past Memorial Day, a 6-year-old in my district ended up in critical condition after being shot by an unsecured gun. I have had the heartbreaking to see so many lives lost and changed in the district because of the violence of a firearm. This crisis touches everyone. There are Democrats that are touched, there are Republicans that are touched, whether you're rural, whether you're urban. No Wisconsinite is safe from the threat of gun violence. Just my personal story, my 17-year-old cousin was shot in Beloit by a 15-year-old. How does a 15-year-old access a gun who does not have a permit to have a gun? And my cousin was med flighted here to Madison, and he is still fighting for his life as I stand here right now on this podium. It has impacted my family like never yet before. What I had to hear in that room from the doctor to my family was something I never want any family to have to hear. This violence is so unacceptable, and this violence is preventable. We are here today because the people in this room, legislators, advocates, members of our community, we love, we know better. We are going to keep fighting. We're going to keep introducing common sense gun safety legislation that protects every Wisconsinite. And we're going to continue to say the names of our loved ones that are gone, but not forgotten. Their lives have been changed and altered permanently to gun violence until the laws finally reflect the value of a human life. In the immortal words of the late Reverend Dr. Martin Luther King Jr., and I quote, "We adopt the means of nonviolence because our end is a community at peace with itself. Our communities will not know peace until we make the conscious choice to address and prevent gun violence." God bless you and thank you.
That should end the conclusion of the symposium, but we do have a few minutes left over if there are any questions from the audience. No, well, I have a question. So for the police department, what is the most prevalent things that you see that are associated with gun violence? Is it arguments? Is it fight? Is it fights domestic?
From what we're seeing in our investigation, so we are able to see everything citywide. We've been seeing a lot of these juvenile offenders have been increasing with our investigations, and it's fights and arguments that escalate. And it can vary. Some are domestic related, some are not. So it really does vary throughout circumstances of everything, but we have seen increase in our juvenile offender groups. And the violence and the fights amongst these groups have been escalating.
And what's the most common way that juveniles are getting their hands on guns?
Unfortunately, so in all of our investigations, when firearms are recovered or we ask in our questioning of the individuals involved, we'll ask where the firearms came from. And a lot of times we're not getting the exact answers. They'll say that they bought them off the street.
And I know we did legislation in this building a couple of years past. It was for violent felons in possession of a gun who had already been convicted of a crime and continue to carry guns. Felons, what's the most common way that they're getting their hands on guns?
A lot of times it's the same answer that we get typically. When we ask how you obtained the firearm, they just said that they either found it laying out or just purchasing it from someone else.
Now, I'll piggyback, and I mentioned this earlier, but we are seeing a lot of people transporting their guns in their vehicles and then going to the bar, or going to a Bucks game, or going to, whatever they may be going to. And then their vehicle gets broken into and their firearms get stolen that way. So we do see a lot of that happening throughout the city. So we try to message, don't secure your firearm in your vehicle wherever you go. That's an easy way for someone to get a gun, whether it be a juvenile or an adult. It's an easy target.
So I'm just gonna put this out here. So that's one of my biggest pet peeves too, especially for the city of Milwaukee. You have people who feel like if they're gonna come into the city, they have to bring their guns. Then they go to places like the Pfizer Forum or the mall that will not allow you to bring those guns inside, and they leave them in the car, which makes it an easy target, like he said, for the theft to happen, but it also puts more guns on the streets in our city. And then we're blamed for the crime that's happening throughout the state. So what's the message surrounding that? What can we tell people who are coming into the city about not feeling safe unless they bring their firearms?
Well, that's a good question. So I would tell them to be cognizant of where you're going to go. If that place, or if you look into that place and you cannot take your firearm in there, know that you run the risk of becoming the victim of your vehicle getting broken into, possibly stolen, and your gun missing. I can't tell someone whether or not they should bring their firearm with them when they go somewhere. But just I want them to be aware of the risks that going somewhere, having your firearm remain in your vehicle can, and what the results can be of that.
Okay. And I have a question for the doctor too. I'm just on the roll today, y'all. So my question for you is for the victims that you're treating. The level of injuries that you're seeing, and also the number of gunshots per victim. Can you describe that for us?
Well, as I mentioned, I'm seeing this both in the hospital side and in the outpatient side. Unfortunately, in the hospital side, those patients I'm seeing are multiple gunshot wounds and usually don't survive the hospital stay. In the outpatient setting, typically it's folks with one or maybe two gunshot wounds, but less severe, who make it. And so this is one of the most, to use a medical word, I'm sorry, virulent forms of disease, right? Like a gunshot is extremely damaging to the human body. So people surviving multiple gunshots, usually their quality of life is extremely, extremely poor. To follow up on your question about family members, and I would add this to family members, friends, anyone who is associated with that person, the trauma associated with it is severe, and that manifests itself in mental and physical health issues as well. So we talk about this as a public health issue because one gunshot is not just one gunshot. That impacts communities, families, friends, anybody. So it's something that I'm really glad we're talking about today, and I hope I answered your question.
You did. On average, or is there an average for the number of bullet wounds you see per victim?
So, in full disclosure, I just moved back to the great state of Wisconsin in September, so I'm very happy to be back. I grew up here. I don't have enough data from here to say for sure, but in the inpatient setting, the number is usually 3+. Here in the outpatient setting, probably closer to 1 to 2.
Okay. And a question for the mom. I know for the funerals that I've been to, especially when I first got elected, umpteen years ago, in the assembly, I used to try to go to every child funeral that I could just to show that that child mattered. And the level of comfort, it seemed like it brought those families just to see my gold pen that didn't cost more than $20. It kind of said to the family that your child mattered.
Yeah.
One of the hardest things for me was trying to figure out what to say to the mom. Because what do you say to a mother?
It's pretty
who's
hard to
sitting on the
say
front row?
anything. I don't think I don't think no one should ever say it's okay. How are you doing? It's okay, because it's not okay. Me, I've come to terms with crying a lot. I'm okay with crying because I feel like that's just me, how I feel. I feel like if I stop crying, I forgot about my son. So I've instilled into myself already to be okay with crying every now and then. I cry a lot and I'm okay with that. It's not like a person can say, don't say, I know how you feeling when you've never been through that. You know, that's not like, don't say that to, especially by me, because I said I'm going to be very defensive. Like, don't say that because you don't know how it feels. Like, you can't say, well, my brother died, so I know how you feel. No, you don't, because it's a different type of pain from mother, father, grandfather, grandmother, sibling, cousins. It's all a different type of pain. My grandfather died. I felt a different type of pain when my son died. My brother died. I felt a different type of pain when my son died. It's just different pains. You can't never say, I know how you feel if you haven't walked in my shoes.
The other thing that I'll say, and I'll close after this, for me, the difficult part was, especially when we talk about the children, especially the innocent victims, because bullets they don't know who their intended target is.
Yeah.
So many of these children live in poverty.
Yeah.
And then we expect these families to be able to bury these kids when they have problems finding the funds for unexpected emergencies. But then they're being stuck with a $10,000 funeral cost. And even if they raise money on GoFundMe is taxed.
Yeah.
You also have to have a bank account to deposit the funds. We ask of these families to do so much. There was one funeral that I went to, and I saw that the family was trying to raise money on GoFundMe, and they didn't quite make it. And so I went to the funeral director and I asked had the family paid for the funeral, and she was reluctant to say. And I said, the only reason I'm asking is because if they hadn't, I wanted to make a donation. And she said, they paid, but I know they went to a check cash in place to pay. These families are forced to go to places that charge 60, 70% interest to bury their kids. And every time they make that payment, it's a constant reminder. We ask these families to do so much, but yet we're willing to do so little in this building. One of the reasons that we brought child victims in the month of June and put them in the rotunda is because Children should matter. They're not Republican, they're not Democrats, they're under the age of 18. And these babies deserve the right to advocate for themselves. So if we can't get this building to act and do something, then maybe seeing those children outside, seeing their faces in life size will be a constant reminder that while we're continuing to enact, children are continuing to die. So once you leave here, I hope that you'll take an opportunity to view some of those faces out in the rotunda. By no means are those all of the victims that we have in Wisconsin. Those are just a small percentage of the victims. But we're walking through marbled corridors every single day. When we go to a different floor, whether it's up to the fourth floor or down to the ground floor, we're riding in gold-plated elevators. There's no reason that every life shouldn't matter in this building. And it's about time that we force the individuals who can make those decisions, who can do something about this gun violence. It's time we make them do their job. So thank you for being here.